Good morning. This is a lecture on aging gracefully. It was given by Professor L.N. Gakuo, EBS, at Presbyterian Churchmen Fellowship Church in Karen on Sunday, 22nd March 2026. I want to introduce Professor Gakuo. He is a renowned orthopedic surgeon in Nairobi, Kenya. Aging gracefully. Aging is progressive. It's a universal decline. A functional reserve, it's not a disease. It increases the risk of diseases. There are 5 attitudes to aging gracefully. Number 1, acceptance. Number 2, develop positive attitude. Number 3, exercise your body and mind. Number 4, broaden your interests. And number 5, recognize and express gratitude to God. This is because God provides all the resources. As you age, you are supposed to be active. You should also make health-conscious choices, and this extends healthy years. We have a few references from the Bible and aging gracefully. Examples are Psalm 92:14. Even in old age, they will still produce fruit, remain vital and green. Ruth 4:15, he will renew your life and sustain you in old age. Isaiah 46:4, and I will still be carrying you. Psalms 91:6, as well as Deuteronomy 32:7 and Genesis 24:1. These are the 4 aging giants. Giant number 1, immobility. Giant number 2, instability. Giant number 3, incontinence. Giant number 4, intellectual impairment. Constipation. This happens as you age. Therefore, to reduce constipation, increase your fluid intake, do daily exercise, and increase the fiber intake in your food. What is postural hypotension? This is caused by bending suddenly or standing suddenly. You should rest after meals to avoid postural hypotension. The 4 risk factors are because of muscle weakness, gait imbalance, use walking aids, avoid drugs, very many polypharmacy. 4, ear dysfunction or dizziness, avoid steps and carpets which may destabilize you and make you fall. What are the incontinence risk factors? Smoking, dementia, obesity, urine leaking and overflow, stress, urge, incontinence. It is treatable by physical exercises and surgery. Aging affects your head, eyes, and ears. The GIT, the gastrointestinal tract, you may have causing ulcers which lead to cancers. The kidney system, the UTI stones, there is 18% chance as you age. The bones, infections, fractures, osteoporosis, osteoarthritis, and gout. There's a 31% chance of getting this. Obesity and high cholesterol, there's 47% of getting this or this affecting your aging. Diabetes, high blood pressure, which is a silent killer, and strokes. There is dementia and COPD. Have good health education about personal hygiene, smoking, and alcohol. Environmental modification, nutritional intervention, and lifestyle behavior changes. Preventive measures, prevention of high blood pressure, because this is a silent killer. Maintain healthy weight, reduce stress, reduce salt intake and alcohol, exercise daily, and have routine checkups. How to avoid high cholesterol, quit smoking, reduce alcohol intake, exercise regularly, maintain healthy weight BMI of 25, and eat less fats. How to avoid arthritis, have regular exercise, like 30 minutes per day for 5 days, maintain healthy weight, avoid joint injuries, and quit smoking. How do you avoid coronary heart disease? Limit sugar, salt, and fats, sleep 7 to 8 hours, reduce stress, exercise regularly, no smoking, and regular checkup. How do you avoid diabetes, which is 27% prevalent in old people? High sugar destroys the eyes, causes cataract, kidneys, nerves, heart, teeth and gums, blood vessels, and it can lead to amputations. How to avoid chronic kidney disease? Reduce the risk factors of diabetes and hypertension. Have regular screening and treatment. Heart failure, is 14% chance in seniors, decrease the risk factors already discussed. Depression affects 14% of seniors. Note that it is suitable, therefore see a doctor. Try to stay connected with family and friends, eat healthy, limit alcohol and caffeine intake, and do exercises. Alzheimer's disease, which also affects 11% of aging people. This is umbrella of cognitive lesion, memory loss. You exercise and stay engaged, have quality sleep, and have a healthy diet. Remember, we are told in Isaiah 46 verse 4 that the Lord loves you. You never abandon you. In Philippians 1:6, God plans. God will perfect you till the end. Wisdom belongs to the aged, as we are told in Job 12 verse 12. Solomon sought interprets of old men, as we are told in 1 Kings 12:6, and also in Job 32 verse 4, seniors deserve respect. And now we can see some slides of some bones. These are slides of bones which are being repaired. You can see these are bones due to they are affected, they are sickly due to osteoporosis. So this is the normal capsule. This is a cartridge. This is called synovium, and this is the bone. This is normal. And osteoarthritis, you'll find there are so many other problems. These are also other slides. You can see the vertebrae, which has been bent with aging. The hip bone, you can see that hip bone over there. And very many others. As you can see, this is knee replacement. This is a sickly knee. This is a replacement. And you can see from another view how the metals look like. This is an example of what happens when you have diabetes and uncontrolled lack of blood circulation. It ends up with killing a limb, and it can be amputated. Also the teeth, take care of your teeth. The oral cavity is very important to avoid sickness as you age. The eyes also can get affected. See a doctor. And that is just other x-rays of deformed vertebrae. This is again a limb which has been affected by a disease as a result of diabetes. So you can see that is normal. A normal joint looks like that. When you have osteoarthritis, you have a thickened capsule, cyst formation and cirrhosis in subchondral bone, sheathing, fibrillated cartilage, osteophytic clipping, synovial hypertrophy, and altered contour of bone. This is also arthritis. You can see how the knees get enlarged due to arthritis. And with that, we come to the end of this theory of aging gracefully. Thank you.